we were going to search for bipartisan solutions to our nation's problems. Unfortunately, that opportunity has not yet arrived, but hope springs eternal. This is just the beginning of what's going to be a very long and complicated parliamentary situation, and I yield to him at this point in time.
Thank you very much, Mr. Chairman. You and I have been here before. We were sitting in different chairs back in 1994. In fact, I remember where I was sitting. I was sitting where Mr. Roskam's sitting right now. But we were both attempting to improve our nation's health care system. And while we're attempting here to improve our nation's health care system, much more than our seats on the dais have changed. In 1994, as we debated health care reform, the full Ways and Means Committee spent 17 days, over 6 weeks, conducting our markup. This year, the markup will last a day, maybe 2 at the most.
I know.
More importantly, in 1994, the Ways and Means Committee held 12 hearings, 8 at subcommittee, 4 at full committee on the bill after its introduction, not counting the 32 additional hearings the full committee and 2 of its subcommittees held before the Clinton bill was formally introduced. We held 1 hearing on the bill before us. However, not one of the witnesses were able to speak knowledgeably about the provisions in the bill because they were only given a couple of days to digest it. It's also worth pointing out that the committee refused to act on the Clinton bill until nearly 3 months after the Congressional Budget Office released a comprehensive 104-page analysis and score. I have a copy of that analysis right here, and it's still available online. We have no such analysis of the bill before us. We have a CBO letter. It's a rough guess estimate based on specifications as outlined by the majority, not on actual legislative text. As Director Elmendorf wrote to the chairman on July 14th of this week, and I quote, "It is important to note, however, that the estimates are based on specifications provided by the Tri-Committee group rather than an analysis of the language released this week. For that reason, and others outlined below, those figures do not represent a formal or complete cost estimate for the coverage provisions of the draft legislation." End quote. We can't afford to guess when it comes to health care. This is not some think tank experiment. These are people's lives, people's jobs we are talking about. Frankly, the Speaker's timeline endangers not only the health of all Americans, but the health of our economy. This committee has no business marking up a bill of which CBO cannot tell us its cost or impacts. What we do know is that Democrat staff told the Associated Press that this bill will spend about $1.5 trillion. Let me repeat that, at least $1.5 trillion, and it will create a massive long-term unfunded mandate that imperils the future of this nation. Worse yet, this bill contains $820 billion in new taxes that will be paid for by families making as little as $20,000, small businesses and manufacturers, all while we are in the midst of a recession. It taxes health care premiums, it taxes jobs, and it taxes wages. The unemployment rate nationally is reaching 10%. The unemployment rate in my home state of Michigan is 15.2%. And the employer mandate alone will cost millions of jobs, making it harder for businesses, especially small ones, to hire new workers or increase their wages. The National Retail Federation, which represents 1 in 5 American workers, strongly opposes this bill, as does the National Federation of Independent Business, the U.S. Chamber of Commerce, and the National Association of Manufacturers. The American people also oppose this bill, and it should come as no surprise that in the past weeks we've seen different public polls showing opposition to this plan grows daily as more details, including the massive tax increases being used to pay for it, become public. And why? Because America knows this plan will force them to lose the health insurance they have and like. At least 2 different independent analyses of the Tri-Committee bill estimate that more than 100 million Americans would lose their current health care coverage. people aren't just going to lose their health insurance, they're going to lose control over their health care decisions under this government takeover of health care. The new Health Commission can arbitrarily determine what treatments and medicines are covered by insurance plans, who is too old or too sick to receive treatment, and compared to the first draft of this bill, makes rationing more likely by the Health Benefits Advisory Committee. There has to be a better way to reform health care in America. Mr. Chairman, all of us know health care reform is needed, but that recognition doesn't absolve us of our duty to make sure we pass legislation that effectively meets the challenges we face. This bill, or at least what we know of it so far, fails that test, and I will vigorously oppose it. And with that, I would yield to Mr. Herger, the ranking member on the Health Subcommittee.
Thank you, Mr. Camp and Mr. Chairman. No one disputes that America's healthcare system needs reform. Rising healthcare costs are putting the squeeze on families, businesses, and government alike while placing quality health coverage completely out of reach for too many Americans. Unfortunately, the bill before us today fails